The YMCA education series is free and open to the public, so we encourage you to spread the word and invite your family and friends to participate. We host approximately 8 to 10 of these programs a month, varying in all different topics. This program will last about an hour, and you might find that you have questions during the presentation. Please feel free to put those questions in the chat box, and they will be answered during the question and answer period. If you do not know how to use the chat box, feel free to raise your hand and ask the question yourself. And they will do the best they can do to answer all questions in the time that is allotted. So thank you again for joining us. And I would like to introduce Denise Schwartz from Manual Touch Physical Therapy. She's going to be talking about healing low back pain and sciatic naturally. So I'm going to turn it over to Denise, and I'm going to mute myself and turn off my camera.
Thank you, Megan.
You're welcome.
Welcome, everybody. As Megan said, I'm Denise Schwartz. I'm the owner of the Manual Touch Physical Therapy in Wheeling, right at Milwaukee and Dundee. So pretty much not too far from Norfolk. Megan mentioned we're going to answer questions. Please save your questions for the end of the program, as everybody's video is off, and then I'm going to be having a PowerPoint that I'm showing you. I won't be able to see any raised hands. So you can do one of two things. You can put the question in the chat box and I'll look at them at the end, or maybe write them down so you remember your questions. Okay, so I'm going to share my screen with you. Hold on a second. Oh, there we go. I hit the wrong button. Okay, you guys should see my opening healing back pain naturally. Okay.
Yes, we see it.
Thank you, Catherine. I appreciate it. Okay. All right. So I'm actually working from doing this presentation from home today and not at my clinic. I was home the last couple of days recovering from a stomach bug that I don't know is going around, but luckily I'm all over it now. But that's why you don't see any physical therapy stuff here. So I'm at home. So I've been a physical therapist for a pretty long time, over 30 years now, and I started working at Lutheran General Hospital many years ago, right out of school. And when I went to school, I knew that the number one reason that people went to their doctor was about back pain. So I took a lot of classes on how to heal back pain and sciatica. And I became quite an expert at it. And I would call those techniques I learned as traditional physical therapy. As I went along, I took other classes as well, so I could learn how to work with all the rest of the body as well. But I really became an expert in back pain. Along the way, I started learning a non-traditional therapy called integrated manual therapy that works with the whole body and looking at what may be preventing someone from healing, possibly from the inside out. And what I found after a couple of years of taking those classes is that I could help everybody with these techniques. Whereas before, my traditional techniques worked really well, but there was a population that didn't respond well to traditional physical therapy. But with the non-traditional added to that, it worked really well. I eventually left the hospital to start the clinic for integrated manual therapy here in the Chicago area, and I worked with them for about 7 years. We parted ways, it'll be 11 years now in August, and I became the Manual Touch Physical Therapy. And what I realized is when I was working for the company for integrated manual therapy, that's all I was doing. And when I went out on my own, I realized all that good traditional stuff that I learned way in the beginning was still good, and I really missed doing that. So now I combine traditional and non-traditional therapies to get people back doing the things that they love to do. Along the way, I had learned developed a passion for running, although not so much the last couple of years. And I started taking lots of classes in running, so I'm an expert in treating runners and triathletes as well. So I already answered this question. What is the number one reason people go to see their doctor? Back pain. All right, so in normal times, which hopefully will be pretty soon, we'll be returning and we're in person, I would normally ask the group, what are your usual pain complaints? But in a webinar like this, it's very difficult to have too much participation. So I sort of wrote down a list of things that I hear on a regular basis from people. And these complaints that people have guide us in diagnosing what is causing your back pain or your sciatica and what we need to do about it. Because we need to know what's causing the problem, because treatment can be different and often is different. There will be overlap, but that's the importance of understanding where this is coming from. And we usually can figure these things out based on what you tell us and our evaluation. So people will often tell me they might have pain, particularly sciatic pain or leg pain, when they're walking or standing for too long. Other people will have pain when they bend over or sit, sometimes transitioning from sit to stand or rolling or getting out of bed in the morning. A lot of people complain of back stiffness, particularly first thing in the morning. And then, of course, there's people who have numbness or tingling somewhere in their leg or all the way down to their foot. This is a ebook that I offer to you called Tips for Mindful Daily Movement that will help you prevent you to have back pain and will also guide you on how to deal with your back pain as well. So if you would like this copy, please put your email and your name, first and last name, in the chat box, and I'll be happy to send you this along with a thank you note. Okay, so what we're going to talk about today are the three most common causes of back pain and sciatica. Now, of course, there are other issues, but these are the three most common that we see in physical therapy. Okay. One is a herniated disc, also known as a slip disc, bulging disc. Second would be stenosis, otherwise known as degenerative disc disease or arthritis, and then sacroiliac joint. And I'm going to explain all these in a moment with some anatomy pictures. The one thing that I see that's common with everybody is postural weakness and immobility. So particularly people who come to me who are younger, like in their 20s, you think about this last year, everybody's sitting down even more. Those are the people who really have pain because of their sitting and their posture, and their back muscles and their core muscles have gotten weak. Now, you could obviously, everybody who has one of these other issues, oh, wait a minute, I need to put on my pointer. 1 second here. There's a way to do this that I forgot last time. Here we go. All right, so I believe you should see my mouse now moving around. Catherine, can you see an arrow?
Yes, I can.
Thank you. I'm going to call on you for when I need some help. Okay, where was I? Okay, so these are the three most common causes, and I would say this is actually a fourth cause, postural weakness, immobility. People often have just weakness. They don't necessarily have any of these other things, but they're just weak, and so their bodies, their back and their trunk fatigue out, so then they have pain. Okay, so let's look at the spine. So this is your lower spine from the side view, okay? Your spine is made up of, the lower spine is your lumbar spine, and it's made up of 5 vertebrae. You got your lumbar number 1, 2, 3, 4, and 5, okay? And in between, and then down here is your sacrum, and then this is your coccyx, or commonly known as your tailbone. In between each vertebral bone or body is your disc, That's the blue part. And then this yellow is the spinal cord coming down through a canal called the spinal canal. And in between each of the vertebrae, a nerve comes out off of the spine and goes somewhere in the body. In your disc here, you can see sort of a white, brighter spot. The disc is made up, that's kind of a jelly center called your nucleus, and it's like a jelly-filled center. And when people herniate a disc, that's actually what's being, that has shifted. So this jelly-filled center applies pressure on the outside of the disc, which then applies pressure on the nerve. Right, so this is looking from the back end. Again, here is lumbar number 1, 2, 3, 4, and 5. This is your pelvis. Here is your sacrum. And off to the side, this is called your ilium on both sides of your pelvis. And your sciatic nerve comes out between L4-5, L5-S1, and from segments of the sacrum. And it creates the largest nerve in your body. And it goes out behind your buttocks in between some muscles. I believe this is your piriformis muscle. And it goes down behind the back of your thigh, and it splits behind your knee, and then goes all the way down to the outside of your foot, and then can affect your big toe as well. This is your sacroiliac joint, known for, here's your sacrum, and here's your ilium, and there's the joint, okay? Okay. So we talked about the sciatic nerve is the largest nerve in the body, and that's what causes, when that gets impinged somewhere up here, and it could be from a herniated disc or bulging disc. It could be from stenosis, which is a narrowing of the canal here, and it impinges on there. Something I probably need to add on this anatomy picture is these are called your facet joints, and that's sort of a connection there between each vertebrae, and that gets narrow sometimes, and that's what impinges the nerve as well. So it could be anywhere up in the spine. Sometimes the nerve can get impinged somewhere down in the back of the leg as well. In other words, the back of your thigh is made up of your hamstring muscles, and the sciatic nerve travels down between the hamstring muscles, and that might become tight and can compress on the nerve. So we have to differentiate, is it coming from here or is it just coming from here? More often than not, when you have true sciatic, it's coming from somewhere up in your spine. But if you have a hamstring strain, it may be kind of confusing whether it's sciatic or not. Sorry, I thought I had some other information here. Okay, so let me go back to the different common causes. So the herniated disc, when people have that, and that usually affects people under the age of 50 or so, although I do see people who have it older. And I certainly have people who come to me and tell me, oh, I was diagnosed with a herniated disc 20 years ago. Well, once you have a herniated disc, that does become a weak link. It's always a weakness, and it is something that you have to keep an eye on. But that may not really be causing your current problem necessarily. People with a herniated disc usually have pain with sitting or bending over. And they may or may not have sciatic. Sometimes it just has sciatic pain and they don't have back pain. Sometimes they just have back pain and not sciatic. And a lot of times what these people have with herniated disc, you might wind up in the emergency room or somewhere, and the doctor will say that you have a muscle strain, but the lumbar muscles are strained and really causing you most of the problem. And my belief is when you are in so much pain here, it's because your body creates its own armor. So your muscles spasm. Sorry, that was the word I was looking for. So your lumbar muscles will go into spasm because they're actually creating a more stiffness to kind of protect your body so you don't herniate further or really injure something more vital than your muscle, your spinal cord. So that lumbar spasm, which is super uncomfortable, is actually serving a purpose. The reason that's important to understand is that just going for a massage to relax those muscle spasms is not necessarily going to take care of the disc or stenosis or SI joint that's going on underneath it. Those muscle spasms are actually protecting everything under here. And if you don't get to the underlying cause, then it doesn't matter how much massage you get, it's more than likely not going to take care of it. The second most common cause is stenosis. And this is basically another term for arthritis of the spinal canal where the spinal cord goes through between all the vertebrae. This usually happens in people really over the age of 55 or so. And common complaints are, I have front of thigh pain in both legs when I stand or walk greater than 10 minutes. That's my first clue that this is really a stenosis problem or arthritis. Again, you might have, some of that lumbar spasm going on. But the other thing that I do find is our third most common cause of back pain is SI joint dysfunction. And what's happening here is these muscles around in the buttock area tend to pull on this sacrum here and can cause just an ever so slight little shift in this area. Again, I believe it's happening to protect what's going on here in a more important area. So I do find some people come in just with an SI problem, but I would say 100%, almost 100% of the time, people with a herniated disc and stenosis all have an SI joint problem. And what we do to take care of that is I do some hands-on work to get this in better position and better in balance. So then we can work on the deeper structures here to help it heal. Common complaints when people have an SI joint problem, they have trouble laying on their back, they have trouble crossing their legs, climbing stairs, sometimes walking. They may say, I feel like I have to just crack my back, and that's often this issue. And that's pretty easy to take care of. We just do a hands-on technique to get this back in better balance, which allows this area to relax, and then we can focus on this upper area. So why is all this really important? And when do we really need an MRI or more testing? So typically, both the doctor and the physical therapist can diagnose what's happening based on your information and our evaluation. It's usually fairly obvious if it's one of those three things. If you're in physical therapy for a few weeks and nothing changes, then it might indicate a time that we want to look a little deeper. Some of the other things that we want to see, and the reason we would take an MRI, or the reason a doctor doesn't do an MRI right away, is because we can figure out these issues from our exam. The reason we might do an MRI is because if your pain is not reproducible. So what does that mean? So I tell this story. A few years ago, I'm someone who's very fortunate. I do not typically have back pain, except when I was pregnant. That was a long time ago. And about 4 years ago, I went out for my morning run and I felt a little SI pain, that sacroiliac pain. I thought that's kind of odd, I didn't do anything special over the weekend that might have caused it, but running didn't make it worse, so I kept going. The next day, it started to get a little worse, and by the third day, it was actually spreading around to my abdomen, which is kind of unusual, but it's hard to diagnose yourself. I went to a friend of mine, another physical therapist, and when we treat each other, sometimes it's sort of like a quick fix thing, but nothing helped, and we didn't really look really deeply. As the fourth day went on and on, I actually couldn't find a position comfortable, and I couldn't get rid of the pain. There was nothing that could make it go away. There was nothing that made it worse. It just was always there. So I knew something else was causing this pain. It was not one of those three things. It was something else because it wasn't reproducible. I went to the ER. I told them it was not musculoskeletal. It wasn't reproducible. They took some tests. They thought it might be a kidney stone because it was my low back. Anyway, by 2:30 in the morning, CAT scans and whatever else, nothing showed up. They said it must be musculoskeletal. I didn't argue because it was 2:30. I took some pain pills and went home. I slowly got better, but what I found was exactly a week later, I scratched my back and I had a rash. So I had shingles. So you can get pain before you have the rash, which makes it extremely difficult to diagnose. But what we learned from that is because I couldn't reproduce the pain, I couldn't reduce it, which means typically physical therapy does not help. And there's something else going on and you need to go to the doctor, you need to go to the emergency room. Now, I do find with shingles, there are some non-traditional therapies that are helpful, which I use with some acupuncture. And actually some of the integrated manual therapy techniques I use is also helpful. But that's an adjunct to taking care of it medically. So this is how we know if physical therapy is going to help and what is going on. So here's some people give me some nice compliments. And my other therapist, Kevin, we both are both very experienced therapists. We have the same philosophy. We look at people as a whole person. Let's see here. Denise helped to heal a back injury that had been bothering me for years. The exercises were simple and effective, and it was also great to have an app and videos for reference. When I last injured my back and tried PT, I treated it for 7 months with none of the results you helped me achieve in a fraction of that amount of time. I really enjoyed your personal and customized approach and the fact that you treated other issues that were plaguing me to help me improve my movement and function. Every time I unload the dishwasher and use the proper posture to protect my back, I think of you. So I do get that a lot. People tell me they hear my voice when they're doing things at home, so they know what to do. The funniest thing is I'm in a women's networking group, and when we used to meet in person, whenever it was my turn to speak, everybody would sit up straight because they knew I was looking at their posture. So as a thank you for coming in today, I'm offering a free phone or telehealth consult. Please give us a call. Go ahead and write this number down. It'll also be at the end of the presentation. And again, if you give me your email in the chat, I will send you a copy of this PowerPoint as well. So what's the biggest mistake people make with sciatica and lower back pain? They ignore it. So the sooner that you come in to take care of it, the sooner that we can help you. So a lot of people, you have a few choices. Some people ignore it and just hope it goes away. Sometimes you alter it with medications, injections, or surgery, why there is a place for that. And I do find often that there's a combination between medications and injections. Really what we want to do is handle it, and we want to help you to feel better and get over this back pain issue at the moment, and teach you how to take care of your body so it doesn't happen again. And so what do we do in physical therapy to get you better? Well, we do a lot of hands-on therapy called manual therapy. We do a lot of education. I really think of myself as an educator first. We teach you about your posture and how to move. That ebook that I have called Mindful Movement will teach you how to move throughout your day so you don't hurt yourself. In physical therapy school, one of the biggest things that they teach us is how to take care of our bodies because we are moving all day long. And, especially when I was working in the hospital, we did a lot more lifting and moving, getting people out of a hospital bed. Early in my career, I worked with people who had strokes who I really needed to help them walk. It took a lot of effort on my part. And if I didn't protect myself every time I went to move and help a patient, I would get hurt. And I'm proud to say I've never hurt my back working. Actually, I've never hurt myself working at all. I pay attention to myself when I move and I do everything. Even, I do hands-on therapy. It's when I've taught over the years some manual therapy skills to other physical therapists. I have to teach them how to protect their hands and make sure they use proper posture for their fingers so they don't get irritated and arthritic. You will learn strengthening exercises, particularly for your core and your legs. You will learn, and your core is all the muscles from between your diaphragm and your pelvic floor, the front and the back. They all work together to help stabilize your spine and protect it. You will learn some mobility exercises. I call this not really stretching because they're active stretching, but it's really to make sure that everything is moving it the way it needs to. So for example, someone comes in and they might have back pain, but I look at them and I see that their ankles don't move very well. Well, I know from my knowledge that if your ankles don't do what they're supposed to do when they're walking, then somewhere else up your body has to make up for it, which means you overstress something and thus you have an injury somewhere else in your body, which we call the chain. So there's pretty direct correlation between what's going on in your ankles and your feet to what's going on in your back. You will learn stability or balance exercises to make sure everything is working together and you are safe on your feet. And then probably more importantly, the most important is neuromuscular re-education, where you learn how to work your whole body together. I talked about the direct correlation of your feet to your core and your hips. And we really need to get all that working together. So a vast majority of your exercises that we will teach you will be on your feet because that's where we function most of the time. Now, I know we're sitting a lot, so we will go over things on how to sit as well. But when you're up and about, and that's when people really get injured and a problem. So it's really important to learn and get stronger and learn how to function and get your feet working with your back and your core. Here are some other testimonials that people have sent over. I've dealt with lower back pain for the last 20 years. And I've been to the manual touch PT twice when the pain was debilitating. Their advice, exercises, and gentle maneuvers really put me back on my feet and allowed me to go back to my normal routine quickly and faster than I had imagined. They look at your whole body and take a holistic approach to putting you back together. So, what are some things that you can do now? So sometimes people ask me to give them exercises here, but I really can't do that safely. We talked about that in the beginning. We really want to know what is going on with you because there are certain exercises, why that there's an overlap in exercises among any diagnosis. There are some specific exercises for each diagnosis. So to give you something that might take care of you, call me and say, oh, I have a herniated disc. You may think you do, and I might give you an exercise for that, but it might make you worse because we don't really know what's going on. So I don't give out just generic back exercises to treat a specific diagnosis. What we do is give you these education on how to move and take care of your body throughout the day so you don't keep injuring it. Some things that you can do that typically are not a problem is to make sure you get up and move every 60 to 90 minutes. Set an alarm if you find that you just sit there for too long. Walk around the house for 5 minutes. Walk sideways every time you move to a new room. So these things, most of the time, everybody can do. Obviously, if it makes you worse, you don't do it. But this is typically where we start people when they're having an acute episode of pain. We need to get you just to start moving. Gone are the days where they put you into bed with traction for 3 weeks, because that just makes everything weak and it doesn't heal anything. So movement is the key. Again, please give me your email and I will send you this ebook so you can learn all those things and how to take care of yourself. As well as I'd be happy to talk to you about what's going on with you and what our recommendations are as well. If you have any questions now that you think that the whole group would benefit from, please ask. If it's something very specific about yourself, then I would be better if you called and we set up a time to chat. Okay, I am going to turn off the share screen so we can ask some questions. All right. Does anybody have any questions? You see, we gained one more person since we started late. No questions from anyone? Oh, walking sideways, what does that help with you? That's a good question. What walking sideways does a couple of things. It works the muscles on the sides of your hips, which are very important to help stabilize your back. It helps with balance. Indirectly, it helps with balance because as your hips get stronger, your balance will get better as well. Okay, any other questions? Just writing down a couple of the emails of people. If you can put your last name in there, it would be good so I can, so I have that correctly. And I will send out a copy of, is gentle or restorative yoga helpful? Yes and no. If you're having an acute episode, I would not recommend it. If you are in the chronic phase or you're past the acute phase and you're basically pain-free, it should be fine. Once you're in the acute phase, the problem comes that some of the movements may be contraindicated depending on what's going on. So you have to be real careful. The other thing with any type of exercise class is you have to really understand your own limitations and not try to keep up with the person standing next to you. You need to listen to your body. What can you do? If something makes you feel worse, then you're really not supposed to do it. More often than not, no pain, no gain is not the answer. There are certain things, certain diagnoses, not in back pain, but in other ways that we do cause pain. So for example, I don't know if anybody's had a frozen shoulder before, or a total knee operation. It's going to hurt. Physical therapy is going to hurt, and it's the only way to get it better because we need to get movement. But more often than not, we don't want you to cause more pain. So be careful in your yoga class, listen to your body. If it doesn't feel right, modify it, ask the instructor to help you to modify it, and make sure that you're doing it correctly as well. Any other questions? Let me try to think if there's anything else I can offer you. How many people are at home working? Anybody? No? Okay. Is everybody retired on my call today? Catherine, you're working? What do you do? So for those people who are working at home, you know, what happened, people needed to realize they needed a good chair and a desk, so they're sitting comfortably in the right position. I did certainly have quite a few people come in because they really flared up stuff during this, the pandemic. So it's nice to get back out and see people. What do you think? All right, well, thank you everyone for coming. Let's see, I think that the Y wants me to tell you a couple of things here. Okay. On behalf of the North Suburban YMCA and our Yes series, we thank you for supporting our organizations and programs like these. Programs like this one are free and open to everyone in our community. So if you enjoyed today's program and would like to support the North Suburban YMCA, please consider helping with a donation at www.nsymca.org. We hope to see you at our next speaker series. Ooh, I have that on another page. I'll get it for you in a second. Somebody asked me, is a standing desk a good idea? Yes, it is a wonderful idea. But you don't want to stand all day. So you use the standing desk intermittently throughout the day. You sit a little bit, you stand a little bit, you move around a little bit. The wonderful thing about a standing desk is when we give you standing exercises, you can just do your exercises while you're working. So you don't have to make special time for that. All right, let me get you what the next program is. Okay, it looks like on June 29th at 7 o'clock. It's called the next one is called Outpatient Joint Replacement. And it's by Dr. Jeffrey Goldstein. I've just heard about this, that they're doing that. What do I have? Oh, I have a patient of mine who's going for a total knee next month, and she could go home later that day. And I did have a woman who, she was like one of the first people to have a total hip last year when surgeons were allowed to start working, like the beginning of June. She was home in like 3 hours. Unbelievable. So if you think you might be the one who needs to get a joint replacement, whether for your hip or knee, that could be a good presentation. Catherine, you're a wealth of information. She is reminding me, those of you who came late, we did record this program and you should be able to see it on the podcast's website. Okay, if there's no other questions, please feel free to call and let me know if you'd like to set up a time to talk. I'd be happy to answer any of your questions and guide you on what we think could help you the best.
I do have
Oh,
a question, Denise.
I see people now.
Yeah, Denise, I have a question. This is Gail.